Mm-hmm.
of the blood vessel.
Mm-hmm. 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 Very good. Very, very good. Okay. So, I know the pronunciations are not quite what you all would. Y'all did your best you wanted to do with it, and that's very good. Very, very good. The thing of it is that I want you all to become familiar with the words, the combining forms, which is the O, because it helps combine to another word to make it another word of itself. Okay, so most of these are what you call root words. Okay, and then you have the suffix. The suffixes belong in the end, prefix belong in the beginning. Combining forms are in the middle because they link the suffix and the root word together, or they link all three together. Okay, so let's turn the page here. Now we have what we call algia and emia, and then you have on page 89 you have ia, and you have itis, and then on page 90 you have different types of inflammation. There are different types of inflammation. Now, page 91, you have Magali. Everybody say Magali.
Magali.
And then you have Oma.
Oma.
Very good. Page 92. Now, you have the anatomy of, which is a uterine and ovaries for women. Okay. So, what you have here is a picture of uterine fibroids here. Okay. And there's different sarcomas and there's different malignant tumors. So before I get any further in depth, let's go back and look at page 88. Let's go back to page 88. And I'm going to ask Karen, this is going to be chapter 3. Let me angle my camera this way. Angle it down that way. Okay. Okay. So I'm going to talk about chapter 3, suffixes. And algia, is that the first word, Karen?
Yes.
Okay, what is the meaning?
Condition of pain.
Mm-hmm. Condition of pain. And what is the next one?
Ischemia.
How you spell it?
EMIA.
Okay, and what does that mean?
Blood condition.
Blood condition. Okay. Athena, what is the next word after that? It should be on the next page.
IA. Yes.
Ia, and what does that mean?
Condition.
Condition. Okay. Okay, what's the next one?
Itis.
Okay, itis. Inflammation. What's the next one? Cindy, you have your book?
Yeah.
Okay, what's the next one? Magali. Mm-hmm. Okay. Let's see. Okay. Kanisha, you have your book? What's the next one?
Oma.
How you spell it?
OMA.
OMA. Oma. Oma means tumor
Or mass.
or mass. Okay. Florida. What's the next one?
OSIS.
How you spell it?
OSIS.
Means.
Condition. Abnormal condition.
Condition of normal.
Abnormal.
Oh, abnormal?
Yeah, abnormal.
Okay.
A necrosis.
Okay,
A necrosis.
okay. That was it? Okay, okay.
Condition.
Okay, gotcha. Thank you, sweetie. The next term, Gabriel. Okay. Okay. Eliana.
Rhea.
How you spell it?
Is two R's.
Uh-huh.
H-E-A.
Uh-huh. And?
Flow discharge.
Arthralgia. So it's pain of the what? Joint. Arth. Arth means joint. Okay. Leukemia, white blood condition, a white blood cell condition. Okay. Pneumonia. Pneumonia is something to do with the respiratory system. Okay. An infection, if you will. What does it say with the proper meaning of it? Of pneumonia.
The meaning.
Oh, the lung is inflamed,
Uh-huh.
causing fluid and material to collect in the air sacs
Uh-huh.
of the lung.
Okay, very good, Allison. So the lungs are inflamed, there's an infection in there, okay? There's different types of pneumonia, okay? Meningitis, we know there's inflammation of the meninges, okay? So that's dealing with the spinal cord covering. Everybody familiar with meningitis, you heard of that being on television. Be careful, don't drink after people, stuff like that, because you can get meningitis. Okay, cardiomegaly, that means large heart or enlargement of heart. Okay, we have oma, like myoma. What does myoma mean? What does mine mean? Benign tumor, but mine means what? Tumor or mass. Okay, so is that what they said about myoma is?
Myoma is saying that this is a benign tumor. Myomas commonly occur in the uterus and are known as fibroids.
Fibroids. Okay, very good. Okay, so mine means also muscle, should mean muscle. So it's a mass of something that has occurred inside the muscle of the uterine area where it's created a fibroid. And yes, it can be benign. What does benign mean? Does anybody have an idea what benign means? Non-cancerous. Very good. If it's malignant, what does that mean? Cancerous. Very good, Allison. Very good. Okay, the next one we have necrosis, condition of, what does nec mean? Necro mean? Necro?
Ischemia?
Okay, ischemia, I'm sorry.
Ischemia.
That's my error, ischemia.
May lead to necrosis.
Uh-huh.
Gangrene is a type of necrosis.
Necrosis, okay. So deadening of the cells, it's ischemia or isk. So I should have pronounced it better that way, and I'm sorry, I apologize, yeah. It's isk. So if there's a blockage, yes, it's gonna cause it to be deadening. Why? Because of oxygenation. Okay, in circulation of the body, the red blood cells carry hemoglobin, and hemoglobin has oxygen and food and nutrients. If there's an ischemic matter going on, then it's going to make it a necrosis type issue. Okay, pathy, cardiomyopathy, disease or condition of the heart muscle. Okay, rhinorrhea, nose or nasal flow discharge. Okay, let's see here. hemorrhage, which is excessive discharge of blood that's causing a hemorrhage or just hemorrhaging, and arteriosclerosis. Okay, so it's hardening of the arteries inside the near the heart and the veins and all that good stuff. Okay, so you have hardening of such. Now, I've written all this up here. So what I want you all to do for homework. Homework, yay! Sorry. Bring it all. Get it this way. Okay. Is how many sentences? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay.
Is this for Wednesday?
Yes. How did you guess? This one, 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 this one. Okay. Now let's look at some good stuff that's in this book. Excuse me, Karen. All right. Okay. So we see some arteriosclerosis going on here on page 95. Okay. What are some things, anybody, I know you should know, Dr. Sunshine. You should know. What are some things we can eat to help bring down such plaque and buildup of this? What are some healthy foods that we can eat to help rid some of this? Page 95. Maybe. That's an idea. Iron is one. Yeah, but you have to, you vegetables. What type of vegetables? Green. Yes, leafy vegetables to help clean out. Because when you eat leafy vegetables, especially if it's going through your arteries, it's going through your intestines, especially if it's cabbage or greens or turnips, collard greens, bok choy, Chinese cabbage, Brussels sprouts, no, not Brussels sprouts. Broccoli, cauliflower, yes. What that does when it travels inside your intestine area, all that plaque you have building up, what that roughage is called roughage. You have to eat roughage, which is fibrous foods. Those are fibrous foods. Is cleaning out all that plaque and stuff up against the wall of your intestines, the walls of your arteries and stuff. So that's good to eat. Eat plenty of roughage, is what we say in the country. Okay, roughage your salads, all arugula, your iceberg lettuce, all your wonderful salads y'all see on what is that, foodtv.com. Okay, eat that. Now, oatmeal is good. Oatmeal is good. Cheerios. Any Cheerio lovers in here? Yeah. Okay. Good. All your Cheerios. You know, you ever see kids eating Cheerios for snacks? It's very good. You know, sometimes if you want to take Cheerios, sometimes I'll lay in bed and watch TV and eat me some Cheerios. Okay. It has oats in it. So it's very good. It goes and it cleans all that buildup, and it helps bring down your cholesterol and your blood pressure. Okay. So my husband is a huge Cheerios fan. Huge. Okay. I like the honey Cheerios preferably. Okay. All right. So let's move right along. And let's look at this procedure. Oh my goodness. Okay, I'm on page 96. Everybody look at this word called synthesis. Say synthesis. Synthesis. Say ectomy. Ectomy means removal. Removal. So that's like if you're having a myomectomy or hysterectomy. Okay, hysterectomy. Tonsil appendectomy. Very good. Tonsil what? Tonsillectomy. Very good. Removal of the tonsils. Very good. Now, let's look at this procedure here. This procedure says technique of the what? Thoracentesis. Everybody say it. Thoracentesis. Okay. This patient is sitting in the correct position for the procedure. The needle is advanced and the fluid, which is the pleural effusion, is being drained. That's because the person is having too much fluid in their lungs. You can drown if you have too much fluid in your lungs. You can drown within yourself. Okay? Okay, very good. Okay, let's see here. What page is this? Okay, so let's look at this. Oh, baby. Say amniocentesis. Okay, so we see that there's an amniocentesis being done. The fetal cells cultured for analysis. They usually have this if they're detecting the mom is going to have some sort of abnormalities with her pregnancy, particularly if you're over the age of 30 or 35. They usually have that, and they take the fluid from the sac, and they try to detect if there's going to be any Down syndrome. Very good. What were you saying, honey?
No, that's what I'm saying. That's one of the tests that they use to detect if the baby's
It's going to be
Down syndrome.
yeah, and it's very. I think it's very good. Sometimes you can have it, and if the mom doesn't want to have it, she can object to have it, but she has to sign a letter saying that she doesn't want to have it. Okay. All right, very good. Let's look at this. This is tonsils and adenoids. Okay, so removal of the tonsils and adenoids is called a tonsillectomy and adenoidectomy. Adenoidectomy. Very good. Okay, so moving right along. Now we're looking at this. So we got a similar picture. Let's look at page 98, and then there was another picture. Let's go back. I think we skipped it here. Going back to page 92. Page 92, where you have the different types of cysts. So there's a predonculated cyst, there's an intramural cyst, erosial cyst, predunculated vaginal, submucosal. There's different types of cysts. I think they're still trying to do research to find out how all these fibroids occur, especially in minority women. I've had a huge fibroid cyst, which was about from here all the way up to here, hitting up my liver. It was preduncle, and it's about as big as a 6-month pregnancy.
Right, yeah. I've known quite a few women that have had something like that, and it almost appeared that they were pregnant,
Yeah.
but it was actually just a cyst.
A cyst, yeah, and I had to have it removed. Yeah. So in order to have that removed, and they do come back from time to time. What feeds them to come back? I don't know. It could be the estrogen that's feeding them, sugars. We don't know. But I had a total hysterectomy. So, and it helped lessen my chances of the cancer coming back too. So it ended up being a life-saving thing more so for me than anything. Yeah. So I just wanted you ladies to look at that. Make sure you take care of yourselves. Try to drink apple cider vinegar, every now and then. Mix it up with 8-ounce water, like 2 tablespoons in 8-ounce water, and try to drink it down. You can make tea out of it if you want to, but it kind of helps, whatever that is, eradicate it. Okay? Because it's a painful thing. I've had fibroids for a long time, and menstrual cycles were nothing nice. Oh my gosh. I mean, I was just like, it's really bad. I could not get up out this bed, And then there are other times I could tolerate it, but it's awful. Okay, so going back to page 98, we have a total hysterectomy. What that means is when a lady has a total hysterectomy, the uterus is removed. So you got the whole V section of the uterus being removed through the abdomen. A BSO is a total abdominal hysterectomy. That's what that acronym means. With bilateral, say saping, everybody say saping, ectomy, and oophorectomy. So that's what that means. Laparoscopic and hysterectomy can be performed as well. So everything that I had it done robotically, and they just went in like that and removed everything out. I had a very good surgeon. She was great. I had another surgeon lady. She just kept giving me the runaround, telling me I had to do this, to lose weight, had to do this. And I've been going to this lady for like 2 years, and I'm like, all you got to do is just open me up and take it out. But for some reason, she had all these prerequisites that I had to do before she could remove it. My weight loss surgeon, Dr. Garth Davis, referred me to one of his friends, Dr. Sherry Levin. And I said, lady, let's get you booked. And I said, okay, well, how you gonna do this? Robotically. I said, don't I need to do this? Don't I need to do that? No. I said, oh, okay. Whipped me up on that table, and I was out within like 2 days.
Wow.
And that's because she was confident. She knew what she was doing, And so you have some doctors, they just rock like that. And you have others, they just,
Just beat around.
Just beat around.
Do this, do that, or whatever.
Yeah. But honey, she had me in and out, and I mean, it took me about like 8 weeks to heal from it. It really, it does take normally that long, 6 to 8 weeks, and it was truly 6 to 8 weeks. Okay, all right, very good. Let's look at the next set of words here. So we already said oophorectomy and septicectomy. Let's say cholecystectomy. Cholecystectomy is performed whenever possible instead of open procedure, okay? So it's really a removal of your gallbladder. Cholecystectomy. Okay, say mastectomy. Mastectomy is removal of the breast, exactly, and that's what I had. I had a right breast mastectomy. All right, so let's look at this. This is a bag, a plastic bag, and then you have an ovary here. So let's read what this is. Laparoscopic oophorectomy. Notice the ovary within a plastic bag. The bag was inserted through the laparoscope and then opened, and the ovary was placed inside the bag. Isn't that neat? Both are extracted through the laparoscope, leaving the uterus and the cut end of the fallopian tube. So that's how it happens, just like that. That is interesting. Does that bother anybody just looking at those pictures? No, not you, Allison. Anybody else? Just a little bit. Okay.
Everybody person.
Okay, but it's just a picture. Okay, just checking, just checking.
This other one, I don't like.
Okay, what picture is this?
The one on page 91.
Page 91? Okay, let me go back and see. Page 91. Oh, yeah, yeah. It's awful.
Yeah.
Yeah, it is awful. Mm-mm-mm-mm.
And that's in your esophagus.
Page 91?
Yeah.
Oh, I'm looking at the
That's in your,
uterus. I'm sorry. Oh,
yeah, that's in your esophagus. That's, I guess that's,
yeah. Adenocarcinoma, that's cancer.
yeah.
Yeah, that's awful. Yeah, you have some folks have esophageal cancer.
Yeah.
Yeah, it's sad. It's really, really sad. Okay, let's look at page 100. So you have electroencephalography. Say electroencephalography. Okay, that's known as your EEG. That's usually done when you're asleep. Anybody ever had a sleep study done? Like a sleep apnea test? Your dad?
My daughter.
Your daughter. Okay, how did she like it? How did she do with it?
She was little.
Oh, she was little. Okay. Was she having seizures? No. Okay. She just had sleep problems. Okay.
Breathe.
Breathing problems. Okay. So she was having apnea problems. Mhm. You got one when you was little? Yeah. Okay.
It was very impressed. All the things they put on her.
Yeah.
My dad has had one, my mom has had one.
Wow. Are they on a CPAP machine? Yeah.
My mom's supposed to be on.
Me too. Me too.
So my dad does it every night. My mom.
How does he fare with it? Does he feel great?
Oh, yeah.
Yeah.
He said he can definitely tell the difference when he doesn't use his machine.
Wow. I have to really work on that. I really do. And I've been supposed to be on it. I've been on and off of it since 2009. But I just hate that feeling, that mask. I feel like somebody's trying to suffocate me.
My mom has had to have, because I remember you were talking about this, last week sometime, that you had one particular mask, and they have new masks now, to where it's like they just pretty much do it in your nose.
Yeah.
We went got my mom fitted, and she liked that one, but still doesn't. She said she just doesn't like it.
Yeah. I really have to work at it. I try everything, sleep aid. I just had the hardest time sleeping with it, just close my eye. Yeah. And so I get migraines. I battle with migraines. I've been having one off and on. Not bad today, but I've had bad ones. And they gave me some sleep medicine, and boy, does it work.
Oh, really?
Yeah. I'm like, oh, yeah. So I'm going to try the machine again, and I'm going to take the sleep medicine like 30 minutes before bed. So it's time I'm just, and then I want to see how well it works. Then maybe it's a mindset thing, and I just have to, and like when I see how well it really works. Other than that, I'm just constantly fighting, and I can't deal with that. It's to help, like, sometimes I'll stop breathing for like so many seconds, and it makes you more tired than normal. And it's not good for your heart either. Sometimes it'll cause high blood pressure and stuff like that. And then sometimes when you sleep, your body loses weight because you're constantly burning energy. Even when you're asleep, you're constantly burning energy. And so the hormones that helps your body relax, but yet diminishes the weight and things like that, metabolize. It helps with your metabolic rate while you're sleeping too. So that's why some of the weight tends to stick on me because I'm not using that. And when I'm not breathing for so many seconds every single night like that, then my body's not functioning at the optimal capacity the way it should function. I still wake up okay, but most days I wake up with a headache. And that's because I'm off and on and breathing. Mhm. My circulation is not getting around like it should. So it's very good to have, especially if you have a person that snores a lot. Did your parents snore a lot? Yeah. Yeah. My brother, oh man, I mean, he would be in the back of the house and you'd be way in the kitchen. And I promise you, you could hear him snore. It was just awful. Oh my gosh, it was awful. So yeah, it helps a whole lot. Okay, so let's look at this mammograms. Now, ladies, now I'm 49 and I have my mammogram every year. Okay. I know she looking at me like, yeah. So do you have yours?
I should be, but.
Okay. Okay. You need to have it done. Yes.
I have not had a PCP in who knows how long.
Wow.
Yeah.
Bless your heart. Bless your heart.
Just, I don't mind doctors, but, if they don't seem right to me, I'm not gonna go. If I've been there and then they just don't seem right or whatever, I won't go, so.
Okay.
Yeah. I know I'm pretty hard-headed when it comes to that.
Okay.
But I had high blood pressure and went to the doctor to, make sure. And what I found out was my mom and my dad both have high blood pressure.
Okay.
And I'm a runner. I pretty much eat well. So when he realized, did all the tests and everything, and everything came out fine. So he said I was just like in that 1% of people that it's hereditary for me. Because I eat pretty good, but it's because of my parents and their parents that have had high blood pressure. That no matter what I do, I won't get rid of it.
Oh wow.
Yeah.
Okay. So you just do the natural thing to?
No, I take pills.
Okay.
I take pills.
Okay.
Yeah.
Good.
But there's just no way, because how some people can get rid of high blood pressure.
Yes.
But I
Yes.
can't.
Okay. So because of position. Okay. But the other things you got to do that every year. Please do that for me. For me, please.
Now, what age do you have to start?
Well, they recommend you to be 40 years old to start having mammograms. But your pap smears, ladies, starts at the age of 18. What is it?
I go every year.
You go, I know that's right. So ladies, if you're 18 and over, you need to be having your pap smear once a year. Okay, well, what they do is in this picture, let's look at this picture here. They go in here and they take it's like a gun. Not a gun. Bad description. Bad description. Okay. It's like
but it's a little metal thing.
Yeah.
Something that opens up.
Yeah, it opens
right.
you up. Okay, it opens you up. They make sure, and they've gotten real savvy now. So, and I used to work for an OB-GYN doctor. So they put the vaginal guns inside this table, right? And once they get it sterilized and stuff like that, if they don't use the plastic ones, they sterilize them, and they keep them in a warm table, warm. Yeah. And they put some nice warm lube on there, and they put the gun, and some kind of way they clamp it open or something, and they take a swab, a nice culture swab, and they just swab the cervix to make sure that you don't have any kind of cancer.
Right.
Okay, because it's ovarian cancer, uterine cancer, cervical cancer. There's different types of HPV.
Right.
You know, that's something new now that's been going on for a while, but it catches things really early. And so I would say for you young ladies, please have Dr. Florida. Give me that look. Yeah. Oh, it's not that bad. Don't scare the young ladies. Don't.
Yeah, I see her. It's like pretty
It's
much
just a little
Yeah.
uncomfortable, but it doesn't
Yeah.
hurt.
You know, the doctor, I put the hand.
Yeah.
Yeah.
Yeah. I mean, it's not awful, but it could
Yeah.
save your life.
Yeah.
It could
Yeah.
save your life. Okay. And you want to make sure, Dr. Florida, you want to make sure that you have that, young ladies. Please do that. It's so critical. Okay.
And the mom,
The mom, do you have daughters?
I have my daughter, but
Did you go with her?
no, my daughter is in the Philippines. Me, I go to the mom.
Okay, to the mammogram. Oh, yeah, the booby squisher.
Oh, yeah.
Yeah, that's, we call them booby squisher. Yeah, your mom knows about the booby squisher. Yeah.
I said, there is no other way.
No other way.
No.
That's just
No.
one test that hasn't been perfected. There's no other way.
Exactly. There's no other way. Now they can do ultrasound.
Yeah.
But that's secondary.
Right.
Yeah.
Right.
Only if
Right.
it's something,
Right.
more serious. But for a preliminary and for what your insurance will pay for, you got to go through the booby squeezer. Sorry. Okay. So now I worked with a lady back in '97. She was in her early 20s. She was like 21, and she had breast cancer at 21 years old. She did. I remember being 24 years old. I was in 5 auto accidents within a 5-year time span. Yeah. And my like back to back. And I think maybe 1 out of the 4 was not my fault. It was just on the freeways twice, when it's raining, stuff like that. It's just one of those things in my life.
Right.
And so anyway, the seatbelt lashed across me so hard that I've developed this fibroid cyst. And so the surgeon looked at it. I'm thinking it was because of the seatbelt, and he said it was benign. It was a fibrous tumor right there. So then I was 24, 19 years later, at 43, I'm developing another knot there, like I did when I was 24. And in my mind, I'm thinking, because I just had my last mammogram was in 2010, and then I skipped a year and I had my mammogram in 2012. And I said, oh, it's just a fibroid, once I get back to teaching again, get my insurance, but I had just finished grad school. Then, I just get it removed. No big deal. It's benign. I've had it in the same spot once before, And so when they said, Miss Harper, we need you to do this mammogram again. I'm like, oh, okay, no worries. Miss Harper, we need you to have a mammogram done. Oh, it's yeah, I know. It's y'all looking at that scar, and yeah. And so they, and then she went out, the technician went out, she went and got the radiology doctor to come in, and then she did the ultrasound, and you could hear the the lips moving.
Right.
And I'm like, I can't see, because they got that sheet on me, and I'm like, what's going on? Because I'm hearing it, and they say, okay, Miss Harper, we need you to sit up. And I'm like, okay, Miss Harper, you have breast cancer. I'm like, what? Miss Harper, you have breast cancer. I'm like, okay, when are you gonna remove it? When are you gonna remove it? Did you hear what we said? I said, yeah, I heard what you said. Now, when are you going to remove this? Because my mind was still back at 24 years old. Like it's no big deal.
Right.
And then the nurses and stuff, they're looking at each other like, okay, I don't think she really got this, grasping what we said. And then they said, Miss Harper, I said, I know. And then I just bust out crying. I know what you said, and how could this happen to me? you know, because I educate people for a living. How could this happen to me?
Right.
And so, long story short, I had my biopsy done. And then the day of my niece's rehearsal dinner, and I was the mistress of ceremony for her rehearsal dinner, they called me 1 hour before I went and told me that it was cancerous after they did the needle biopsy of it. And it was just my story, my journey ever since. So now from 24 years old, I mean, it was benign, you know, and then in the same exact spot 19 years later. I can't say it enough, ladies. You know, if you know you have a genetic, like you say, in your family, disposition in your family where your mom may have had it.
Your mom had it, or?
No, my
What
aunt
year?
did.
Oh.
My aunt did. My aunt had, my mom's baby sister had breast cancer at about the same age. Exactly, about the same age. And then I did not know until maybe about the same time, but this was long after my grandmother had died, that my dad's mom had breast cancer. See, I didn't know it was in the tree like that. Then my mom's mother had, I think it was cervical cancer, I think, or uterine cancer, I can't remember, but she has cervical cancer. So they're interrelated because whatever the hormones do, like when you get your menstrual time, the cramps appear, it affects disappear. And that's when you tell your boyfriends and your girlfriends, don't touch me. And I'm not feeling it right now. No, that hurt. No, that hurt. Ooh, just stop. Back up. Okay? And I get like that with mine. So so that's how that happens. And so it's interchanging of the estrogen hormones. Is everybody getting that? Okay. So ladies, you know, check yourself. If you have those genetics in your family, please request and ask your doctor, you know, to have it. And they can always write a letter of medical necessity for your insurance to pay for it. Yeah, your insurance may deny it, but if they write a letter of medical necessity to say that it's a genetic reason, the mother, the grandmother, the aunt, whomever, you know, the next of kin, she wants to make sure. You just never know. I don't wish that on anybody. I really don't. But for my coworker and then me, I mean, you just never know. So I'd rather you all be safe than sorry. Okay?
Are cancers like runs in the family if somebody had all types of cancer?
Not exactly all types. Now, lung cancer is different, you know, in my regard,
What about
from
the
experience.
kidney?
Kidney, yeah.
Is that like when it
Mhm.
runs
Yeah, yeah. You want to have yourself tested. There's a lab called the CA-125. I'm not sure how much it costs, but whenever you go to your OB-GYN doctor or your primary care physician, ask them to do a CA-125 lab on you. And that'll tell by the cells, you know, if you have it or not. That's one of the indicators. It's not a guarantee, but at least that's one of the indicators, one of the starts. Mm-hmm. Mm-hmm.
and they can check what other types of cancer you might be with your blood.
If they detect that you like they'll palpate, they'll feel your back where your kidneys are. If they can detect that there's a growth of some sort there, then they may have an x-ray there of your kidneys. Yeah, I had to have a biopsy of my kidneys. Yeah, because I had a growth there, but it was benign. Yeah, that kind of hurt people, but
That's why, I have a tip for all ladies.
okay. What's your tip, Dr.
When
Flo?
you take a shower, you take a shower.
Oh,
It's the time it's the time of breath,
Mm-hmm.
because you know sometimes you need to massage. You know why? Because you have like yeah, you need to massage. You know?
Mm-hmm. 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 Very good. Thank you, Dr. Flo. Thank you.
And did you know that you need to exercise your tongue?
Exercise your tongue? How do you exercise your tongue?
Go like that. Then to the left, to the right. You know why?
Why?
Because it exercise your
Thank you,
big nerve
sweetie.
in the brain.
Really?
Yeah.
If you exercise your tongue, like this,
Yeah. Yeah.
it exercises your brain?
Yeah, the nerve in the brain, the big nerve.
Yeah.
Yeah. It connects your go to the brain.
Yeah.
You need to exercise your tongue. I told to my coworker, but they laughed.
Wow.
The employees are crazy.
Well, no, I believe in Eastern medicine and Chinese medicine. I have that at my house. I have a book up on that, but I haven't come across that yet. Thank you, because I'm getting ready to take my license exam. I need all the exercise I can get. All right, thank you everybody for your health information. We're signing out. Y'all have a blessed day. Come in tomorrow ready to talk about chapters 1, 2, and maybe 3. Okay. Depends on what the time will allow.